Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-Spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends on Thursday, July the 27th. I want to introduce two of my smiling friends sitting next to me from Columbia Healthy Smile. We have Dr. Philip Batson and Dr. Elizabeth Abe, the husband and wife dentist team. Good to have you both here today.
Thanks for having us.
We try to cover all the different dental topics, and I think it's been maybe a couple of years since we talked about this particular topic, and that's introducing young kids to the dentist. That you got to be gentle about it, but it has to happen, and you want to try to make it a pleasant experience. First of all, at what age should you start talking to the kids about going to the dentist?
Well, it actually starts pretty young, and a lot of that starts at home usually first, as they start to get their first teeth in around 6 months old. Parents can gently clean them, sometimes with a wet washcloth at first, and then they make child brushes and things. But as far as first visit to the dentist, we get this question from parents pretty often, and the American Academy Pediatric Dentistry recommends around age 1 or 6 months after their first tooth comes in.
So the first tooth will come in about what age? 5 to 6 months?
Mm-hmm.
And then so 6 months after that, you should take your child to the dentist.
Yep.
Now, on that first dental visit, what happens?
It's more about talking to the parents of what their home life is like in terms of diet and, pacifiers or bottles and things like that, just to make sure the parent knows how to take care of a baby's teeth and mouth.
Do you actually examine the baby's teeth at that time?
We do. We do take a look, and usually it involves some crying, but at that time, it is kind of nice.
The baby crying or the parents crying?
Hopefully just the baby.
Okay.
And then we can see everything actually when they do. But it's really quick, and it's just to make sure things are on track and nothing is out of the ordinary.
So that's at about a year?
Yes.
But you don't actually do any x-rays or cleaning of the teeth, do you?
No, typically not.
Okay. So at about a year, the child should go to the dentist. Then what? When's the next visit?
We recommend then that the parents start bringing them every 6 months, and usually at that time, and usually that's just in conjunction with the parent's visit if the parent is a patient of the practice. And that allows two things. One, that the child's getting regular checkups and beginning to get things looked at, and two, gets them used to coming to a dentist office.
That's what I was gonna say.
As they grow and develop, they get used to the sights, the sounds, the smells, it's a different environment. And then we're able just to talk with the parents about here's how you can coach them at home and what to do at home to get them comfortable for visits. And every child develops and gets comfortable at different speeds. But we always try to introduce maybe one new thing a visit so that it's a nice, comfortable learning experience for the child.
Yeah. So if a child starts learning to come to the dentist, I would guess at 3 or 4 years old, they're starting to comprehend the dentist, right?
Yeah.
And you want to try to make it a fun experience. Do you find that when you have been with a child from 2 or 3 years old up to 7, 8, when they really start having to have dental care, that there's a difference as far as them feeling relaxed and better about it?
I do think so, yeah. And again, a lot of it is just about being comfortable and kind of knowing us or knowing the office and knowing that their parents come and
Right.
things like that. So
Now, as far as the baby teeth, do you ever see cavities in the first teeth that come in, the baby teeth?
yes.
And if there is a cavity, would you fill that cavity, or since it's going to fall out anyway, do you just let it go?
So it really depends on how old the patient is too. But yes, sometimes we do need to fill them because they will have some of their baby teeth until they're about 10, 12, 13 years old. Some of the ones in the front you tend to lose earlier, but there are different options now that we can kind of delay treatment until a kid feels more comfortable, or if we feel like they're going to lose that too soon. So it really depends on the situation. And
So you do see cavities in baby teeth.
yes, all the time.
What causes the cavities?
The same thing that can cause it in an adult tooth. If home care is a big thing, brushing, keeping things clean, and educating that, like Dr. Abe said, that some of these teeth are going to be around until the child's 12 years old, and we want them to hold on to those teeth.
Yeah. So what are the last baby teeth that fall out?
They're back molars, so they're kind of right in the middle of their mouth by the time they start to fall out.
And that's at about 10 or 12 years old?
Starting about 10 for some girls, but you can hold on to them till even about 12, 13 years old.
Is there ever a time where they are not going to come out naturally and they have to be given a little tug to come out?
We've helped some baby teeth out. Yeah, if sometimes it's an eruption pattern. If the baby tooth's not getting out of the way for the adult tooth to come in, you have to help it out and get it and get. And
so what happens when the baby tooth is there? The adult tooth is forming and it's pushing up, and it's going to push. It pushes the baby tooth out. Is that the way it works?
Kind of. What it's actually doing is that our teeth have roots, right, that hold the tooth in our jaw. As the permanent tooth starts to come in, the adult tooth, it actually starts to absorb and take away the root of the baby tooth, and that's why when you get a loose tooth, all you're left with is the tooth that you see, because all the root structure has
I didn't realize
dissolved.
that. So it's the adult tooth is absorbing the roots of the baby teeth.
Kind of, in a nutshell, yes.
Yeah, so when that tooth, the baby tooth falls out, that's right. It's just the tooth.
Yeah.
There's no roots to it.
Yes.
And then the adult tooth is going to grow.
can come right through the gums and right into the place it should.
Okay. All right. Well, I had a whole bunch more questions, but we ran out of time. But if you want more information about this, you can go to their website, www.columbiahealthysmiles.com. Don't be afraid to take the kids to the dentist early.
We like seeing them and getting them used to what the dentist is like.
Yeah. So have you put your two kids in the dental chair?
Our oldest has been in it so far.
Been in the dental chair.
We do check the youngest at home.
Okay. All right. Thank you both
Thank
so
you.
much for coming by. If there's something you'd like to hear or see, I would love to hear from you. Drop me an email. That's pepperp@missouri.edu. See ya. Bye-bye.